Hi, once again a very good evening. So our second session for today. So we'll start with our image-based questions, orthodontics. Right, we have set of 10 images. All you need to do is identify the image or the appliance or device. We'll have brief description pertaining to each device or appliance, and then we will conclude our session. A very good evening. Suresh, the conference was fine. Thanks for asking. Okay, we'll start with our first question. So I've decreased the brightness and contrast of my screen so that the images will be much more appreciable, right? Let me know if you want any further changes. Also let me know if the streaming is not fine or the voice is low, right? We'll proceed accordingly. Okay, do you want me to raise my voice? Thumbs up if everything is fine. Or if you have any issue, do drop the same in the comment section. Okay, we'll have our first question. Identify the appliance. If you want, I'll give you a hint, or else just based on the visual appearance, see if you can identify. You can see a band. You can see a band on molar. You can see a tube which is soldered to a molar, and then you can see a U-shaped rod. And the base of this U-shaped rod is in contact with the tooth, which is mesial to edentulous area. And you can see a coil spring, compressed coil spring, which generates forces and helps in distalizing this first molar. So it's nothing but Gerber space regainer. It's not a space maintainer, it's a space regainer based on the coil spring, right? You can say the same. So we have either a crown or a loop which is attached to a tooth which has to be distalized. And then you can see a U-shaped rod and a hollow tubing soldered to mesial aspect of molar, and a U-shaped rod with the base towards the tooth which is mesial to the edentulous area, right? So we have a coil spring which is compressed and placed, and this generates forces which enables distalization of the molar in this case. Gerber space regainer. Good. It's not band and loop. Okay? Yeah, it's a space regainer. Wonderful. Now let's move on to the next one. Identify this intraoral appliance. You can see bands on premolars as well as molars. You can see heavy gauze wires, and you can see a kind of screw system on the palatal aspect. So what is this appliance? Obviously it seems to be tooth-borne appliance. Wonderful. Rapid maxillary expansion, Hyrax appliance. Can you tell what Hyrax stands for? Can you expand Hyrax? This is Hyrax. It's a special kind of screw. It's used for arch expansion. Good. Yes, Hyrax. Yes, Ankit. Hygiene, rapid expander. Good. Helps in rapid maxillary expansion. So we have maxillary expansion devices, soft tissue borne and tooth borne. So this is a tooth borne appliance, Hyrax appliance, a special kind of screw with soldered wires conforming to the palatal contours of premolars as well as molars. You can see the banding of premolars and molars, right? Rapid maxillary expansion, Hyrax, hygienic, rapid expander. It's a single screw system. This entire thing is considered to be a screw. This particular unit is called as Hyrax. Yes, Ramya, I hope you got it right. Hyrax itself means hygienic rapid expander. It's not a slow expansion device. Good. Now let's move on to the next one. Identify the appliance. Identify the appliance. It's an illustration where you can see Adam's clasp on premolars as well as molars, an acrylic plate, an omega shaped wire, 1.25 mm wire is selected, an omega shaped wire, which also somehow seems to be expanding maxilla. Slow expansion device enables dento-alveolar expansion. In case of young patients, even skeletal expansion to some extent is possible. So name this appliance. Wonderful. You might have done that in your third year, right? Coffin spring. Slow expansion. Good. We open the coil, we open the spring and then place it, engage it. It helps in slow dento-alveolar expansion. Also skeletal expansion to some extent is possible in case of young patients. Yes, coffin spring. Now, if you want me to zoom in, I can. Identify the appliance. So you can see an acrylic plate, Adam's clasp on molars, and there seems to be some labial bow. Can you name this appliance and what it's used for? Definitely it's a kind of Hollis retainer, but can you be more specific? Based on the contour of labial bow. It's a type of Hollis appliance. We even covered this in our E-classes, orthodontics section. Yes, Chandan Dev. Good. Yes, Rukaya. Yes, Kiran's. Yeah, it's used for retention after completion of fixed orthodontic therapy. Can you observe the contour of your labial bow or the outline of labial bow? It seems to be following the contour of the labial aspect of incisors as well as canines. It's called as fitted labial bow. It's not used for making or dissipating or altering the position of a tooth. Rather, it's more or less used for retention once fixed orthodontic therapy is completed. It's called as fitted labial bow. Hollis retainer with fitted labial bow. It cannot be used for space closure because of the orientation of the labial bow. Yes, wonderful. Now let's move on to the next one. Identify the appliance. You might have done plenty of these appliances during your undergraduation. Identify the appliance. There seems to be two coils, and it seems to be having an arm which is around 10 to 12 millimeters in length, 10 to 12 millimeters approximately. And these coils, we have in fact cantilever. It's a double cantilever spring. It's also called as double cantilever spring. So I'm giving you all hints possible. By the way, you have already given the name. Wonderful. It's a jet spring. It resembles the shape of jet. Jet spring. Double cantilever. Cantilever is a kind of structure where you have support only on one side. So you have two cantilevers, also called as double cantilever spring. So what is the use of this double cantilever spring? Yeah, it can be used for correcting single tooth crossbite, for labial positioning of a single tooth or two teeth. It also can be used for correcting mild rotations. If one loop is activated, it can be used for correcting rotations, mild rotation. If two loops are opened up, 2 to 3 mm opening up, then it's used for labial movement of a particular tooth or teeth, right? And it's made of wire 0.5 mm in diameter, right? It's a jet spring. Good, Vibhu. It can be used for correcting minor rotations as we discussed. So it's a jet spring, right? Now let's move on to the next one. Identify the appliance. You might have done at least one during your third year. Yes, Akriti, 0.5 mm. Cathal O'Neill, how do you know when you need to replace a tooth? I swallow cum. Cathal, if you have any questions pertaining to other topics, you can get back to me through mail. proudtobedentist@gmail.com. We'll definitely discuss, right? Yes, Sanju, well said. So this is vestibular screen, also called as oral screen. So it's used for intercepting various habits, mouth breathing habit, or it can be thumb sucking, lip biting, cheek biting. Also, it can help in harnessing forces from circumoral muscles and implementing or directing those forces, minor forces onto teeth, or it can be used for eliminating those circumoral muscle forces on teeth. It can be used two ways, right? It's usually used for intercepting various habits, including mouth breathing, thumb sucking, lip biting, or cheek biting. So the ring which you see is actually enables the patient to remove and place it for holding the appliance, isn't it? Right? So it's a oral screen or vestibular screen for mouth breathing habit rather. Good. Now, next one. Identify the appliance. So it helps in harnessing forces to produce certain kind of movements, and the one which you are seeing actually is called as force module. So the length of force module that's selected depends upon the amount of space between the band which is present on the upper molar, and on lower canine you can see a ball kind structure. So till that we'll try to measure the length and we'll add up 12 mm, and based on the obtained value we select a force module pertaining to this appliance. It's this particular ball, if you can see, right? It's called as Lexan ball. Lexan ball. It's a myofunctional appliance. Good. So it's indicated in case of class 2 malocclusion, where there is maxillary excess with mandibular deficiency. So based on the selection of this force module, as I said, based on the distance, we measure the distance between this molar and canine, the Lexan ball, and then add up 12 to the value which we obtain. We select a corresponding force module and then we place it here. During occlusion, this force module, since it is longer, it bends, creating a mesial force in mandible and a distal force in maxilla, right? This is nothing but, as you all rightly mentioned, Jasper jumper. Jasper jumper. Good. Okay. Now let's move on to the next one. Identify the appliance. I'll zoom in for you. So you can see straps, the cervical part of the head as well as the occipital part of the head. It's a headgear, that's understood. We have different types of headgears. So which type of headgear is it? Is it cervical headgear or a face bow kind? A reversible headgear, occipital headgear? So what kind of headgear is it? Cathal, I already answered your question. Just get back to me through mail. We'll definitely discuss any topic which is not pertaining to this particular live session in my mail. Right? Just get back to me through mail. You can see, yes, Daivika seems to be having the right answer. Cervical and occipital. So it's a combination kind of headgear. So when forces from cervical and occipital are nullified or equal, not nullified, but if the forces are equal, cervical and occipital, then there will be distal and slight upward movement or force created on maxilla. So depending upon varying the force content in cervical and occipital, we can alter the direction or the magnitude of force, right? So desired force direction can be achieved. So it's a combination headgear, combination of occipital and cervical headgears, right? When the forces from these two types are equal, then there is slight upward and distal force acting on maxillary teeth as well as on maxilla. Shalini, I can't answer your specific question because obviously I'm not giving the exam, I'm not conducting the exam, right? So it depends. I hope the images which come across an exam are clear. I can only hope. Obviously they will be clear, so don't worry, they will be clear. Next one, identify the appliance. I've even given the cross section on left side. Right side you can see the model or the appliance on a cast. Identify the appliance which is used for correcting anterior crossbite. You can see in the cross section we have a 45 degrees plane which enables the maxillary teeth to bite in a more to slip or to slide in a more forward position. So it's used for correcting maxillary anterior crossbites. I'm sorry. So identify this appliance. Yes, it's an anterior bite plane. It's to be more accurate, lower anterior bite plane or inclined plane, or it's also called as wonderful Catalan appliance. Catalan appliance. As you can see, we have a 45 degree slope which enables the maxillary teeth, which are, if at all, lingually or palatally placed, to come more into labial position. So for correcting anterior crossbites. Catalan appliance, right? Also make a note that if this appliance is placed for more than 6 weeks, what happens? What could be the consequence? Can anyone guess? If this appliance is left for more than 6 weeks or for a longer duration, it leads to posterior crossbite, anterior open bite, both, or any other anomaly. Exactly, anterior open bite. So why do you see anterior open bite if this appliance is left for a longer duration? It's given as more than 6 weeks. It should not be left for more than 6 weeks. Why? What could be the reason for this open bite? Yes, it's anterior open bite because of most probably supra-eruption of posterior teeth. Wonderful. Harsh? Okay, exclusion of molars, rather, right. Let's move on to the final image of today's image-based discussion. Identify the appliance. I'll zoom in. You can see some crowns and you can see a bar extending distally. I also suggest you to look into the other teeth. So identify the appliance. Exactly. Yes, Kritika, refer Prophet. You have beautiful images over there. You will not have any confusion. Yes, it's a distal shoe. It's a distal shoe space maintainer. So you can see there is, if at all, there is loss of primary second molar. Usually primary second molar helps in maintaining or guiding the eruption of permanent first molar. So if at all primary second molar is lost, then we create this crown or band-like structure on primary first molar with a distal extension, which is in fact an intra-alveolar appliance. So you can see radiographically the metal going deeper, 0.5, 1.5 to 2 mm, gingival to mesial marginal ridge of first molar, in order to guide the eruption of permanent first molar, in order to prevent mesial tipping or mesial migration of teeth, as you know. So the appliance here is distal shoe or intra-alveolar appliance. Canine, I don't know why canine is involved. Maybe there was some caries lesion, but usually it's not necessary in an ideal case scenario, right? So we take retention from primary first molar. Fine. So we have one general image. So before I post the general image, I'll try to just go through the names of appliances really quick, if at all you're coming to session late. So this is Gerber's Space Regainer. So you can see band, U-shaped rod, coil spring, Gerber Space Regainer. And this is Hyrax appliance. Hygienic Rapid Expander, Hyrax. Coffin spring, omega shaped, slow dental alveolar expansion. It's a Hollis appliance with fitted labial bow. Fitted in the sense the labial bow conforms to the anatomy or contours of the labial aspect of teeth, anterior teeth. And this is double cantilever spring or yeah, just give me 1 second. I think we're having some kind of disturbance in our live comments. Yeah, I just eliminated that. Yeah, it's done, Ankit. Okay, so this is double cantilever spring or jet spring, right? Mild rotations and for labial positioning of it. This is oral screen, vestibular screen, right? And Jasper jumper in case of maxillary class 2s. Class 2 skeletal malocclusions with maxillary excess and mandibular deficiency. Combination headgear, look into the picture carefully, right? Cervical as well as occipital straps. And this is Catalan's appliance or lower inclined plane, lower anterior inclined plane for correcting crossbites, anterior crossbites. And this is distal shoe, intra-alveolar appliance. And finally, identify this place. That's not the question. There is a related question. Identify the place, then I'll ask you the related question. You might assume that this is a simple one, but that's not the main question. Okay, Harsh, you're late. Anyways, I think I sum up all the images, right? It's same, Richa. Oral screen or vestibular screen, it's the same. Okay, good. It's Eiffel Tower, Paris, France capital Paris, Eiffel Tower. So what material is it made of? So that's the question. What material is it made of? Eiffel Tower. Okay, Ankit, congratulations for not saying Pakistan or Afghanistan. Yes, Chandan, CSF is performed in order to prevent relapse. Forum says plaster, Monica says iron, Harsh says tough one, Rukia says steel, few of you say stainless steel. Ankit says cast iron. Okay, you're close, but is it made of, as you said, iron? It's right. It's iron. Which kind of iron? Wrought iron or cast iron? If at all it is either wrought iron or cast iron, what is the difference between the two? Because that's a question which is related to us and we have it in our dental materials as well. Is it cast iron or wrought iron? I don't know what puddling iron is, Amu. With options we have this problem. We don't think, we just randomly choose, right? So we'll definitely have fill in the blanks in coming future. So those who say wrought iron, hope you haven't googled it. So it's wrought iron where the carbon content is less than 0.4% if I'm not wrong. So the difference between wrought and cast is in the carbon content. Anyways, Google it, you'll get a Wikipedia article. So you can definitely go through that article on Eiffel Tower. Corrosion resistant? I'll let you know. Harsh, you said this seems to be ortho question? Yes, maybe you can correlate. Yes, cast iron has more iron content, more than 2%, 2.4%. Fine. So I hope you enjoyed today's session. So I wish you all the best for tomorrow's day of opportunity. So keep giving your best and you will definitely receive the best. So see you again in another live session as soon as possible. And we're having a study club discussion now. We'll have it in another 5-10 minutes after we conclude this live session. Right? Jubair, glad to hear that. You're welcome. You're most welcome. Yeah, all the best to everyone. Just enjoy tomorrow's exam. Don't forget this. You're going to enjoy. Make sure you give your best. And see you again tomorrow in our WhatsApp update group. Bye. Yeah, you're welcome. Rock it. Rock tomorrow's exam. Rock it and shake it. Yeah. Bye. You're welcome. You're all most welcome.